Hello, everybody. Hope you're doing well. There's been such great information and presentation, so I really appreciate that and that you're here for this final two presentations. My name is Kamlesh Tello, and I'm a manager at the Mental Health Commission of Canada, and I oversee our work on healthcare worker psychological health and safety and structural stigma. I've had the pleasure of working with Ivy Bourgeot. Also, Jelena was on a project together where we worked on a toolkit as well. So I'm excited to hear more about other toolkits as well from Jelena, and looking forward to Sarah's presentation. So I'll do a quick introduction and then they can get into their presentation. So Sarah Simkin is a family practice anesthetist and health workforce researcher. She is on the health workforce planning theme co-lead for the Canadian Health Workforce Network, and an assistant professor at the University of Ottawa. She is the co-lead of the Healthy Professional Worker Medicine case study and has helped with various aspects of the project. And Sarah is going to be presenting in a moment on methodological reflections of the team on conducting mental health research on professional workers. And then after that, Jelena Atanackovic is going to be presenting, and she is a senior research associate at University of Ottawa and a member of the Canadian Health Workforce Network. Jelena was highly engaged in the midwifery and dentistry case studies of the Healthy Professional Worker Project and was co-leading the HPW trainee network and also helping with the HPW project's overall coordination. And Jelena is going to present on reflections on the development of the toolkits to improve the mental health of professional workers. So I'll be moderating a discussion Q&A with all of you following the two presentations. So please feel free to put in questions into the chat, but you can also raise your hand when we have the Q&A period. So thanks, and over to Sarah.
Thanks so much, Kamlesh. Can you confirm that you can see my slides?
Yes, we can see them.
Okay, great. Great. Well, thanks for the opportunity to talk about or to share some methodological reflections. I'm presenting on behalf of myself, Melissa Carente, Jelena, and Ivy. And this particular part of the project started because we noticed that many interviews were touching upon difficult subjects. And I spent an afternoon reviewing interview transcripts. And at the end of that, I felt worn out. I felt really awful. And I started wondering, like recognizing how I felt and connecting it to the work that I'd been doing. And I started wondering, how are our trainees coping? So if this work is having this impact on me, and I have professional training that helps me deal with these kinds of things, I have lots of experience with dealing with difficult subject matter material, and I have a supportive network, and I'm still struggling. So how are our trainees doing? Do we need to look at this a little bit further? Are we doing enough to support them? That's where all this started. So I'm going to tell you a little bit about where those questions took us. First, they took us to the literature. And what we learned when we looked at the literature was that there isn't very much out there about mental health researchers. There are a number of studies of graduate students, and what we know about graduate students is that they experience mental health challenges, that stress, depression, anxiety are pretty common, that there are lots of stresses that are particular to graduate studies, like uncertainty, financial stress, having to move and have your social network disrupted, burnout, social, political, climate challenges, and the publish or perish culture of academia that we've heard about already today. Um, but what the literature suggests is there's actually a really wide variation in graduate student context and circumstances, and that a lot of variability in across departments and in the environmental factors that influence the mental health of graduate students. There is some emerging research around graduate studies and in the COVID context. And I think it's generally accepted that how graduate students seek help is not that well understood. So, um, given all that, there are a few scattered guidelines for fostering a supportive research environment, some from the US and some international guidelines. And they suggest that interventions should recognize the diverse needs and experiences of graduate students. And there's some literature with recommendations aimed at a range of stakeholders from senior leaders to graduate deans, program directors and department chairs, graduate faculty, the students themselves, and funding agencies. But I didn't find anything specific to a project like this, something that we could take away and say, oh, this is what we should be doing to support our trainees. I did find a little bit of research um, from forensics and trauma that talked about some of the risks of this research that include secondary traumatic stress, vicarious trauma, and compassion fatigue, as well as some of the potential benefits for participants, including post traumatic growth, like hope and optimism, and resilience arising from self care and good supervision. So, there are maybe some transferable aspects of that literature, but again, nothing specific to the kind of research that we've been engaged in this project. Um, there was also a small pocket of research about mentorship of minority mental health researchers that might be useful, especially when it comes to thinking about what we might recommend be done in another project like this. So, having reviewed the literature and identified some fairly significant gaps, we created a sub team and we decided to conduct some exit interviews with our trainees and co investigators. These interviews explored personal mental health, training network responsibilities, and best practices. We did two trainee interviews. We received five written responses from trainees, three written responses from investigators and co investigators, and we interviewed the partnership director. What we were hoping to achieve was to explore the issues and considerations related to the mental health of mental health researchers and to identify leading practices that mental health research teams can adopt to sustain and support the mental health of their members. This essentially is an opportunity for us to apply our own research. So here's what we heard. On the one hand, one of the trainees said, I love the interaction with team members. Being part of a multicultural, multidiscipline, multi organizational team was fantastic. It has laid the foundation for some of the work I want to do. We also heard there were a couple of interviews that hit a little close to home. It was easy to draw parallels in people's experiences, especially those that were particularly struggling at work or with their mental health. So we're getting a bit of a sense of the optimism about this kind of work and also some of the challenges associated with it. When we looked at the themes of the interviews and the information we collected on exit, we found that stress, anxiety, and burnout were common mental health challenges amongst our both trainees and co-investigators. And I think it's important to keep in mind that this whole study happened in a COVID context, and so stress, anxiety, and burnout were quite common. We heard about challenges including accountability, prioritizing tasks, the chain of communication, and conflict within the group. We heard about the rewards of participating in this research, including making connections, learning new skills, and feeling respected and valued as a team member. The trainees and co investigators shared with us various coping strategies that they used um, to help them deal with the stresses associated with this work. So, talking with their partners or friends, spending time in nature, doing painting. They made some suggestions to us around clearer communications about expectations and timelines. And we drew a number of recommendations, including formal onboarding experiences, partner interviewing protocols, built in debrief times, and resources for trainees. And from all of that, we have pulled together a series of considerations for mental health research teams that we intend to put together and publish with the intention of making it easier for the next group doing this kind of work. Um, and these considerations include considering the baseline stresses of graduate studies. So just understanding that our trainees have um, various stresses that they're coping with, and understanding the diversity of that experience. So getting to know our trainees and and getting to know what their personal circumstances are, what their personal challenges are, and then using that information to help guide how we can best support them. Also, understanding and considering the unique challenges of mental health research. So, recognizing that this research can potentially generate additional stress just because of the content, and anticipating that that could potentially happen. Um, Implementing formal supports and processes is something that we think is important to do. And we did a number of the things that showed up in the recommendations from the participants in this particular part of the study. We had a very active and well led training network. We did formal onboarding. We used a partner interviewing protocol. At least in my group, we had a built in debrief time after interviews that was very helpful for both the primary interviewer and the supportive interviewer. So I feel like we did a lot of things right, but there's always an opportunity to improve, and we don't really have a good sense of how evenly those supports and processes were applied across the case studies. Um, I think it's clear that that in research such as this, we should anticipate challenges to our own mental health and proactively promote self care for everybody, including trainees, investigators, co investigators, anybody who's involved. We should ensure that our trainees are supervised effectively, that we have good connections with them, that we're checking in with them to make sure that they're doing okay, and leverage mentorship opportunities. And that's something that we didn't do, that I believe happened, but that we didn't do formally as much as is potentially an opportunity. Um, Making mental health resources available proactively, so to trainees prior to conducting interviews, is something that probably should be done. That we certainly in my case study, we didn't think about. We thought a lot about how to support the participants in our interviews in case they were distressed, but we didn't think quite so much about how to support ourselves in advance. And so basically, we're suggesting that as a research team, we walk the walk and do the things necessary to keep ourselves healthy as we study mental health challenges. So, three things to take away: the mental health of mental health researchers needs to be discussed and supported. Interventions at both individual and team levels can support the mental health of researchers. And sustaining and supporting mental health, research in mental health requires a multi layered strategy that focuses on prevention, support, and remediation.
Thank you, Sarah. I just want to share a comment so I don't lose that regarding the research area. So Angela says, as a trainee on the project, I really appreciated the attention paid to our mental health. Thank you for asking the hard questions and checking in. I remember it being difficult to tease out what was related specifically to the content of the researcher or research versus broader context of being a graduate student. So thanks for that comment, Angela, and stressing the importance of the focus on trainees. And then Ivy says, I think we are seeing several connected layers: the supervision of students in the projects, our supervision by our managers, and their mental health, definitely. And I think it's so important to include trainees in the study. I think it can be challenging for them to raise concerns. For trainees, they could be new to the work or new to the team, and just kind of finding their way as they're navigating this context. And so how much psychological safety do they feel that they have to share and seek help and expect change to happen? And so thanks for shining a light on the experience of the trainees. I think it's the first step to better understanding the issues. And then you've offered several considerations for the mental health research teams. So I think as a first step, we've got a strong group here today. And the call to action is to really dive into the research that you've done, to go over the findings and see what is an initial step that, one can take the next time that they are going to be working with a trainee. I think something small and then building on that would be great as a call to action. I don't want to take more time away from discussion by everybody. So first, I think we'll go to Jelena. She'll do her presentation, and then we'll also open it up. Thanks, Sarah. Jelena, over to you.
You can. I'll try to share my screen now. Okay, can you see the presentation?
Yeah, yes, we can.
Okay, thank you. Just having trouble opening it on my end here. I can start again, sorry. It's just technical difficulties. In the meantime, I will share a link to the toolkit. Okay, so. Can you see it now?
Yeah, we can.
Okay, that's great. Thank you. Hello, everyone. I'm pleased to be here today and have an opportunity to deliver this presentation on behalf of the Healthy Professional Worker Partnership team. Today, you had a chance to hear a lot about our Healthy Professional Worker Partnership and different case studies it involved. As a last component of our project, we have worked on developing Healthy Professional Worker Toolkit, which incorporates a toolkit for each case study. In this presentation, I will reflect on the process of its development. As you had a chance to hear in the number of presentations today, high levels of stress and burnout have been reported among professional workers pre-pandemic, and these mental health concerns have been exacerbated by the pandemic. Thus, the aim of our HPW toolkit was to support individual professional workers in 6 professions included in our project, namely academia, dentistry, medicine, midwifery, nursing, and teaching. Thus, under the umbrella of our HPW toolkit, we have 6 profession-specific toolkits that are catering to the needs of each professional group. Our approach to the toolkit development was very comprehensive. The interventions and promising practices in our matrices have been collected from multiple sources. First, we did a systematic targeted searches of academic and gray literature at both national and international level in order to find high-quality evidence-based resources. This was supplemented with the interventions and promising practices we identified through our semi-structured interviews with stakeholders and workers. To help curate our toolkit, we created an Excel-based extraction tool to record relevant information about each intervention or promising practice that we found. The Excel chart had a number of categories, including name of promising practice or intervention, profession, description of promising practice, focus, theme of intervention, and so on. All the categories included in the toolkit extraction tool are shown on this slide. After we extracted the resources we wanted to include, we created analytic matrices in which we recorded relevant information related to each of the interventions and promising practices. As this slide shows, our analytic matrices classify interventions by level, by intervention level, and by different teams. Our toolkit topics included themes or components that are important to the issue of mental health at work. And these themes are promoting mental health and resilience, managing stress and work-life balance, workload management, conflict, bullying and harassment, discrimination and bias, and seeking help. While these are the core themes that each case study team included in their toolkits, some of the teams added new themes that they considered relevant to their profession. For instance, in the case of midwifery, we added a new theme, changing cultural perceptions of the profession. Under this theme, we included interventions and promising practices that aim to promote respect for midwives as competent and trustworthy healthcare professionals. The interventions in our toolkit focus on different levels: system, organizational, team, and individual level. I would now like to briefly reflect on what each of the intervention levels incorporates. System-level interventions and promising practices target policies at an association union level, collective agreements, government action, or advocacy. Organization-level interventions and promising practices focus on policies within an organization, leadership development, and training opportunities within the work environment. Team-level interventions and promising practices focus on peer support, mentorship, and leadership within a group setting. Individual-level interventions and promising practices that we included in our toolkit focus on working empowerment, changes in the work culture, or are aimed at the leadership within a division. While we aimed not to include interventions that place the onus on the individual to fix themselves, interestingly, many of the interventions that we found during our search were of that nature. We also included the interventions that focus on gender, age, race, and other identities and their intersections. For each of case study professions, we incorporated a variety of resources in different formats, including academic papers, reports, blogs, programs, policies, webinars, workshops, and so on. HPW Toolkit is accessible through Healthy Professional Worker Partnership website, along with 2 other toolkits, Sex and Gender-Based Analysis Toolkit and Health Worker Burnout Toolkit. Here is a snapshot of HPW Midwifery Toolkit. As you can see on the left-hand side of the page, there are some filtering options that allow users to select interventions by intervention level, and focus or theme of the intervention. You can click on Sort A to Z option to see the interventions in an alphabetical order. You can also search for interventions by typing out keywords and using a search button. Under each listed intervention, there is a short summary describing it. The title of each intervention is hyperlinked so that users can visit the link and find more about it if interested. We wanted to create a community of support for professional workers. So if you try a resource and like it, feel free to click on the logo and you can leave a comment for others to read. It is important to know that our toolkit is available in both English and French. In the chat, I have provided a link to our toolkit so that you can explore it in your own time if you wish to do so. To wrap up, I would like to reflect on some lessons we learned during the process of development of our toolkit that could be useful for others who are planning to curate similar toolkits or for any other researchers who are interested in the issue of mental health at work. First, given the rising rates of mental health concerns, and especially post-pandemic, professional workers need workplace mental health support. Also, toolkits need to be profession-specific to cater to their specific workplace mental health needs. Third, toolkits also need to be curated in a comprehensive way to include evidence-informed resources. Finally, while most of the available resources focus on the individual level, complementing these with system and organizational level approaches will be more impactful, given that multifaceted approach to interventions has been proven to be the most effective. Thank you for your attention.
Thank you, Jelena. That's so helpful and great resource to have. And I think it's so helpful that it's also profession specific so that it is appreciating the different contexts for different professions as well. And and the filter is wonderful too. I'm sure that makes it very easier for people to go through, and the toolkit really just pulls together kind of a hub for folks to go where they can find some best practices there, because there is so much information out there, but it's just sifting through it all. So I think the filter is so helpful. Well, I wanted to open it up to folks. If you have questions, you can put them in the chat or you could raise your hand as well. Ivy, go ahead.
Great, thank you so much. I did want to reflect a little bit on both presentations. So first of all, to kind of reflect on the interventions. And in part, our hope through this project when we initially proposed it is that we were going to identify interventions, we were going to test interventions. And then what we found is that there was a lot of variability between what literature there was to support interventions. There is a very robust literature in medicine and nursing and almost absent literature in the case of accounting, academia. And so many of the elements of the in the toolkit needed to be informed by the research that we undertook. And so it's important to note that. So we were very much appreciated getting some follow-up funding to develop the health worker burnout toolkit, which was a strategic funding initiative through the Canadian Institutes of Health Research, the Institute for Health Service and Policy Research. So that was very beneficial. Jelena mentioned that during the middle of our our project, there were also funds to develop a sex and gender-based analysis toolkit, which Jelena was a co-lead on that in partnership with folks within Health Canada. So looking at a public service professional focus. And so we learned a lot from those toolkits, and more recently with the health worker burnout toolkit, of the importance of working in partnership with organizations to develop them, to implement them, and to have lessons learned. And so it came up earlier in the presentation with medicine, the importance of developing these types of resources but going the next step and working in partnership with the implementation of those resources. So that has been, some important lessons learned. Excuse me. I think I've talked a lot today, so I'm going to pass back to you, Kamlesh. Thank you.
Thank you. Do folks have any questions for Sarah or Jelena? There is a comment that was left here as well during the presentation. Natasha wrote, as a trainee with the partnership, I echo that what Sarah mentioned, that the trainee network provided support and guidance. I was able to connect regularly with the lead trainees on my experiences. I greatly appreciate it. Thanks for that comment, Natasha. Good to know what worked well for our learnings and reflections going forward. So perhaps I could ask a question to you, Jelena. In terms of some specific interventions, do you have gender-sensitive interventions in your toolkit?
That's a really good question, Cam. While we were creating the toolkits, we noticed there is a lack of gender-sensitive interventions. Gender is important to keep in mind, and it's because it's really important factor in shaping the experiences of professional workers. Unfortunately, through our research, we discovered only few, as I said, and few gender-sensitive mental health interventions. For instance, women in dentistry is a group of female dentists gathered together to chat about an array of issues relevant to women in dental profession. And they sometimes have a wellness speaker events, and they have they can socialize, they have opportunities to socialize through that circle. So when we did interviews with the dentists, they told us that they find these circles, women dentists find these circles really beneficial, and they described it as extremely helpful. So thank you for raising that important question.
Thanks, Jelena. Maybe I will just switch gears and Sarah, ask you a question while we wait for folks to ask any other questions.
Carolyn has her hand up.
Oh, I'm sorry, I didn't see. Carolyn, please go ahead.
Thank you. Thanks, Ivy. And these were great presentations again. Maybe a question about tailoring. I think in the physician world, we certainly have come to appreciate that they want a menu of different options. Everyone's different. That came out today as well in your research. And even at the CMA, we've been trying to put resources in our wellness hub. And we are now creating a space specifically for Indigenous physicians and learners, again, recognizing that need for tailoring. And CAMH, when they launched the suicide line, we had conversations with their leaders about, well, are you going to at some point tailor some of your responses to certain groups? And of course, the firemen wanted tailoring, the frontline services want them as well. So my question to the group and to you is, at what point realistically can we tailor all these interventions to all the groups? And that's, I think, the tension that I struggle with sometimes in view of our limited resources. So maybe, I don't know if anyone has thoughts around that. Thank you.
I can start, and I think Jelena will be able to provide some follow-up with that. There are two levels of tailoring. There's tailoring in terms of making the toolkits specific to certain professions and recognizing that there are distinct work content, work context factors, as Cecilia was mentioning, around models of care, around midwifery, wanted to take those into consideration. Violence that is being experienced by teachers, and so making sure that there's some tailoring in that way. Another layer of tailoring is that you can have a self-service toolkit. You could make it as intuitive and as easy to sort as possible, but if people are experiencing mental health issues, especially burnout, they are overwhelmed. And to go to a self-service toolkit to see all of these different resources is another layer of oppression. And it's kind of like what Kevin said, if we have to add on that this is another set of work that you have to do, that can be overwhelming. So the other layer of tailoring that we have found through our health worker burnout project is we have acted in the context of the research project as personal shoppers for different organizations. We go to the toolkit, so we do some research with them first to understand what their major issues are, whether that is, feeling, disconnected because everyone's working remotely, or, there are issues around the leadership, that they're supportive or not supportive leadership. And we go to the toolkit and we select a set of outfits for them to try on, and they will tailor it to their organization. And so that's what has happened. So that's an additional set of resources, and we're going to be testing that more explicitly in a new project that is another spin-off of that. So there are those two layers of tailoring that I think that we need to do in order to make the interventions work better. And so we're really excited about partnering with others in that regard, because those were some really important lessons learned from the project. Jelena, you may have some additional comments.
Thank you, Ivy. So these two layers of tailoring are really important that I've already discussed. And I just wanted to reflect a little bit more on the first layer of tailoring. I guess whenever we are making these kind of toolkits, it's important to keep in mind that different teams carry different weight, or better to say, unequal value for certain professions. So for instance, bullying and harassment and interventions focusing on addressing that issue can be more important for midwives than dentists or accountants, because we know that inter and intraprofessional dynamics, including bullying and harassment, have been described as one of the major factors contributing to mental health concerns in the context of midwives' work. And while this issue is present in dentistry too, it seems to be less prominent in that particular profession, or accounting as well. So we just have to be careful, and that we are tailoring these interventions to the needs of specific profession. Thank you. I hope that answers your question.
Thanks for that great question. And it also indirectly asked one of my questions too, about how to, you say you can build it, but they may not come, right? We talked about that, I heard that today. And so this is a one response is, to provide that personal shopper sort of service model. Also organizations that are dedicating staffing resources. So having a wellness, staff member or a wellness committee are also folks that can be utilizing the toolkit as well, supporting their different departments. I also want to give an opportunity to also hear a little bit more from Sarah as well, and wanted to ask you, Sarah, if you could speak to what worked well in the study and what would you change?
Yeah, thanks, Kamlesh. I think we did a lot of things right. I think the biggest thing that I would change would be to anticipate that this is going to be hard. It honestly, it surprised me how hard some of those interviews were. And when I started reading them sequentially, how hard that was. Interviews I hadn't participated in were still weighing on me. And so I think it, just recognizing that this work is hard and that we need to anticipate that and be prepared will stand us and anyone else doing this kind of work in good stead in terms of doing this both well and safely. So, doing it in a way that doesn't put researchers at risk of stress, anxiety, burnout, their own mental health issues. So, I think that's what we learned, or what we learned, and what we hope to share with others doing this work.
Thanks, Sarah. And so really speaking to the point about learning from this and being proactive going forward too, that future folks can be more prepared for it, having different strategies in place to support folks too as they move through the research process. Thank you. So I don't see any other questions, but so I'm happy to hand off to Ivy to close off things.
Great, thank you so much. So let me just get on my right screen here. So thank you everybody for sticking with us. I just wanted to make a few closing remarks. So first of all, many thanks to all of our HPW partnership research team. This was an amazing team to work with. I learned so much. It was an enormous privilege to be co-leading this. I learned so much on the topic, including, you know, what Sarah just shared with us, that we need to be mindful of the impact. There are so many stories that I carry with me, and they become sort of my North Star for the additional work that we're doing. There are sometimes we came out of interviews and I was just shaking my head. I have no idea how some of these folks are continuing to stand up and continuing to go to work. So I learned so much on the topic. I learned so much about leading a team in a very distributed leadership approach. So I just really want to thank everybody for that support, to the co-leads who exemplified that distributed leadership. And just kind of, you know, remembering, you know, what we started, why we started working on this project, because, you know, these are supposed to be good jobs, professional jobs. And so just really kind of unpacking the layers of stress that are being experienced. And so our project was very meta in that self, especially with respect to the academia project that we were all sort of lurking on that one. I really learned a lot, both, you know, in terms of social media and infographics and how to, you know, visually represent things, being sort of we would talk about being a Batman and Robin in these dual interviews. And so learning so much from the trainees in that process, and very much on how the training network was supported by Jelena and Melissa. So thank you so much for that. And of course, you know, thank you to Audrey for being there, Lisa before that, and Henrietta for, you know, all of the questions that we had about the survey. And as other people have mentioned, the leadership that Sarah provided for us to create a survey that wasn't, it was still a monster, but slightly less of a monster for that. And I just wanted to share some selected feedback from investigators, and it will all be very positive. And I'm really glad that we were able to get some constructive feedback through the process that Sarah mentioned. So some people mentioned it was great to have an opportunity to study the mental health experiences of professionals and to bring change to the way their profession typically approach those issues. And it's been a privilege to participate that. And others reflected that this was a really amazing interprofessional, really rich experience to learn from a diverse group of professionals from diverse backgrounds and enhancing our collective ability to move forward. Others found it really rewarding to work across disciplines and across universities. That was challenging. And in fact, you know, we worked on Zoom before that was really a thing, because it was really a coast-to-coast team. And for me, from another person, another one of the investigators, the partnership was interdisciplinary in the best way. And here are some examples in academia working across psychology, sociology, quantitative, qualitative methods for this common goal. And really wonderful feedback from trainees that being part of this large project taught them about teamwork and collaboration and the importance of clear and consistent communication. And the importance of asking questions and being open to that. And I want to reflect on this last one, being honored to be part of this project as a graduate research assistant, building up skills and knowledge and of the research process. But also, you know, as you know, Sarah was mentioned, being emotionally exhausting, hearing some of the stories from nurses during COVID. And in some days you were very saddened, angered, by the lack of support, and some days wept. And I think that is something that many of us experienced. So we also wanted to thank very much our partners who are here, who supported this research, and we are hoping that can use this work and moving forward on the various messages that we have, key messages going forward. So really hope to continue that and build on that with continued research that we're doing. And these are blank because we would love to hear from you about what you think and thought about the healthy professional worker process and partnership. And so, as has been mentioned, we really want you to respond to us, fill in the survey, put any comments in the chat, send us some comments by email, especially as it's fresh in your mind in terms of what we should be doing going forward, what was the impact of this process and partnership, and so we can pull that in. And again, to thank again the support that we received from the partnership grant from CHR and SSHRC and the other continued funds that we received. Stay tuned, connect with us on social media. We will be posting the presentations today. We have taken some photos of the presenters and our discussants and really want to get the word out. So please do share that. And thank you so much, everybody. And I wish that you were here with us. I wish that we had the opportunity to go out for a drink, to host a Saint-Cassette. So please do something nice for yourself this afternoon. We're giving you a little bit of extra time. Go for a walk. Get yourself some flowers, get yourself, your favorite drink, or go for ice cream, but please do something good for yourself, because we absolutely need to do that. So thank you to everybody. Really appreciate you sticking out with us and looking forward to the next steps going forward. So thanks so much.